This is her at 6 weeks, and again, this is remarkable. On a diabetic, overweight female of that particular age, to see this type of work going on in the body as far as that beginning to fill in and become solid bone. There's the alignment at 8 weeks, much better. She's actually got an arch.
Doctor?
Yep.
When you go and see people like a year later, is everything still as stabilized as we're seeing at the 8 weeks out and such?
Yeah, good question. You know, I should probably have some more long-term, but I like to fix people and, you know, let them go. Sometimes, obviously, if they're not having a problem, they just don't come back to you. I could probably schedule follow-up visits if I'm going to do a study. And I do get a chance to see them if they bring in a relative or something like this. Occasionally they'll have a problem with the other foot, and I'll repeat an x-ray. And I do have longer cases out than just simply 8 weeks. But I didn't want to, you know, regale you with 50 million slides. But it's a good question. It's a valid question. And I always criticize speakers who won't show weight-bearing pictures after surgery, who won't show long-term. So, point well taken. But yeah, to answer the long story short, yeah, they do good.
Sort of a similar question. We're seeing a lot of good pictures of those voids being filled by that osteocell bone. Mm-hmm. Do you ever see cases where it continues and moves outside of your margin, starts to do any crowding, or starts to lump or bump or anything like that?
Yeah, that was one of the advantages of the stem cells, as opposed to the BMP. You know, the OP1, the infuse, those type of things, that's uncontrolled growth. It's in concentrations that are way beyond physiologic. The type of bone, the adventitial bone that's being produced, there's a lot of nightmares from, you know, pharyngeal swelling and people dying because they can't breathe anymore because the ACD fusions have just gone on to proliferate bone in the foot. I know some surgeons who jumped on the bandwagon with BMPs and they end up doing 3 or 4 surgeries to debride bone from the calcaneus because they tried to get it diffused with the BMPs, and it kept on producing, and it kept on producing, and it kept on producing. You don't see that with stem cells. It's a controlled, you know, what is it, 1964, Marshall McLuhan said, the media is the message. Well, when you put a stem cell into the media from a biologic standpoint, it gives it the message to turn into what it is that you put it into. But that's it. Pretty much stops there. It's normal growth. It's just at a faster rate. Pretty cool stuff. All right. Safe, effective, less expensive than BMPs, for sure. Can be used more. No, son of a gun. All right. Can be used more than once in a lifetime. If you're talking about the BMP thing, you can only use it once. It's not associated with teratogenicity, as I mentioned before. There's no unwanted, to answer your question, bone. And it puts the cells right where they need them to become osteocytes to produce, and at high enough concentrations to produce new bone. Do I have more? That's it. All right. Again, I thank you very, very much for what you do, and like I say on behalf of myself, that you help me when you help my patients because we solve problems together, and thanks for your time. Any other questions? Yep.
I was just wondering, when you do the implant, how do you contain the osteocell where you want it to be?
Good question. When you insert it, well, first off, I guess I didn't cover that. When I'm doing surgery, I do what's called anatomic dissection. There are layers that you go through, and so I go through them one at a time, and I preserve them, so that when I'm going to be closing it, I'm closing the joint capsule, and I'm closing the deep fascia. And I do other things to enhance my results as well, using platelet-rich gel and platelet-poor gel too, but that holds it in place. Other questions?
Have you noticed any correlations with certain factors like someone's dominant versus like weaker foot, weight, age, any of those kind of things that factor into these type of manifestations?
Yes. Yes and no. Not always. There's a lot of other comorbidities that they could have. And again, you saw a number of people up here who had diabetes, peripheral neuropathy, osteoporosis, and things like this all play into it.
It seemed like there was a lot of people that seemed to be, you know, on bigger size. So.
Absolutely. I live in Oklahoma. Not quite the grits belt, but I think we're number 2, but we're trying harder. I think we're behind Texas. I'm not sure. It'll be okay. Another question.
You're using platelet-rich gel.
Yes.
In conjunction with stem cell. Why?
Why not? Again, I'm going to cheat. I'm not going to use something that I don't think is going to work. But what's in platelet-rich gel? platelet-derived growth factors, VEGF, insulin growth factor 1, and a number of other things that will stimulate. Those are the messengers that go to those the mesenchymal stem cells and tell them to turn into an osteoblast, or help them differentiate along those lines to the cells that produce bone. So it makes sense to me from a physiologic standpoint. If I can do something that can be osteoconductive, I'm going to do it too. You know, the cells themselves produce their own BMP, 2 and 6 in normal physiologic, but you can speed it along, I think. Other questions? Yes.
Have you used Allostem yet?
Yes, I have.
Okay, and as far as it compared to a granular versus this substrate, what's your impression so far?
I like the fact that it delivers more stem cells than what osteocell does. That's a definite advantage. I personally feel, and this is just something after studying the different stem cell lines, that the adipose-derived stem cells have the ability to perhaps become more active than bone marrow.